Look at your fingernails right now. I mean, really look at them, not the quick glance you give them when you wash your hands or trim them. Press down on one nail for 2 seconds and let go. Then watch how fast the color comes back. That tiny change may seem unimportant, but it can reveal more about your body than most people over 60 have ever been told. Welcome to Health Wisdom. I'm Dr. William, and I've spent 15 years in internal medicine, helping adults catch quiet warning signs before they turn into real emergencies. And today, we're talking about something most people completely overlook. If your nails look a certain way after 60, your body may be quietly hiding 4 serious diseases. The reason this matters so much is simple. Many health problems do not begin with pain, panic, or dramatic symptoms. They begin with subtle changes your body has been trying to show you for weeks, months, or even years. Your nails can become one of those warning lights, and once you know how to read them, you may never look at your hands the same way again. Most people think of nails as cosmetic. They think about polish, trimming, dryness, or maybe a broken edge that catches on a sweater. But medically, your nails are far more interesting than that. They grow from living tissue under the base of the nail, and that tissue depends on healthy blood flow, good oxygen delivery, steady nutrition, and a nervous system that is working the way it should. In other words, your nails are not just sitting there doing nothing. They are constantly responding to what your circulation is doing, what your heart is doing, and what the smallest blood vessels in your body are doing every single day. That matters even more after the age of 60, because this is the stage of life when the body often becomes quieter, not louder, when something starts going wrong. Problems can build slowly. The body compensates. You still get up, make breakfast, go shopping, talk to the grandkids, and live your normal life. Meanwhile, one tiny clue may already be showing up in your nail beds, and almost nobody has told you to pay attention to it. Before we go any further, I want you to stay with me to the very end, because the 4th sign is the one people miss the most, and it is also one of the easiest to check at home. I also want you to do something simple while you watch this. If you are over 60, take a mental note of what your nails look like today. If heart disease, stroke, poor circulation, or anemia runs in your family, listen especially closely, because the signs we're covering today may matter even more for you. And if this kind of information helps you feel more prepared and more in control of your health, make sure you stay connected with Health Wisdom, because this channel is here to make medical information easier, clearer, and more useful in real life. I don't want to scare you, and I definitely do not want you diagnosing yourself from one little symptom. What I do want is for you to become better at noticing patterns, because early attention can change outcomes, and many people only realize that after they wish they had looked sooner. To understand why nails can reveal so much, you need a quick picture of what is happening underneath them. At the base of every nail is an area called the nail matrix. That is where new nail tissue is formed. Beneath the nail bed are tiny blood vessels called capillaries, some of the smallest in your entire body. These vessels are extremely sensitive to changes in circulation, oxygen levels, inflammation, and vascular health. When your heart pumps less efficiently, when your arteries begin to narrow, when oxygen delivery is reduced, or when the blood is not moving through the smallest vessels the way it should. Those changes can show up in your nails earlier than most people realize. Younger bodies often hide those problems well. They have more reserve, they can compensate longer, but after 60, the margin becomes thinner. That does not mean your body is weak. It means it has been working hard for decades, and now it may be less able to cover up small problems before they become visible. Think of your nails as one of the clearest little windows into the health of your circulation. And that is exactly why today's signs matter. The first sign I want you to watch for is a bluish or purplish tint under the nail bed. This is one of those changes many people shrug off as cold hands, bad lighting, or just getting older. Sometimes it is harmless and temporary, especially if you've been in a cold room. But when that color keeps showing up, especially near the base of the nail, it deserves attention. A persistent blue or purple tone can be a sign that your blood is not carrying or delivering oxygen as well as it should. In some people, this points to circulation trouble in the hands and feet. In others, it may be related to deeper issues involving the heart or lungs. The reason I take this seriously in older adults is because conditions like early heart failure can develop quietly. There may be no dramatic chest pain, no collapse, no movie scene emergency, just subtle fatigue, mild shortness of breath, swelling that comes and goes, and a change in how the nails look. That is why I never want you to ignore a color shift that keeps returning for no clear reason. There is a very important difference here, and it can change how urgently you respond. If the bluish color shows up mainly in the nails, especially when your hands are cold, and your lips and tongue still look normal and pink, that may suggest a circulation problem in the extremities. It is still worth mentioning to your doctor, but it is not automatically an emergency. On the other hand, if you ever notice a bluish tint not only in the nails, but also in the lips, tongue, or inside of the mouth, that is a much more serious sign. That can mean the blood leaving the heart is not being oxygenated properly, and that needs urgent medical attention. This is one of those moments where I want you to trust what you see. Do not talk yourself out of it. Do not wait a week just to see what happens if your whole face and nails are telling you oxygen delivery is off. I've seen too many people dismiss these changes because they don't feel dramatic enough, only to find out later that the body had been trying to wave a flag for months. I remember cases like a man in his early 70s who had noticed that his nails looked darker and slightly purple in the mornings. He blamed the air conditioning, then the weather, then his age. He kept saying the same thing a lot of people say. I figured it was normal for someone my age, but when he finally brought it up during a routine visit, the conversation led to more testing. And those tests uncovered early heart failure before it turned into a full crisis. That is exactly why these signs matter. Not because every unusual nail means disaster, but because sometimes one small visible clue is the thing that gets the right question asked. So if you look at your nails in good daylight and the color seems persistently bluish or purplish, especially near the base, and it does not improve once your hands are warm, write it down. Pay attention to whether you also have shortness of breath, ankle swelling, unusual fatigue, or reduced exercise tolerance. Those patterns together matter far more than any single symptom by itself, and they deserve a real conversation with your doctor. The second sign is brittle, splitting, slow-growing nails. And this one fools almost everybody because it sounds so ordinary. People tell me all the time, "Doctor, my nails are just aging with me." And yes, nails can change with age. But when nails suddenly become much more fragile, peel in layers, split down the middle, or stop growing the way they used to, I want you to think beyond dry weather or weak nail polish remover. I want you to think about blood flow. Healthy nail growth depends on a healthy supply line. If the nail matrix is not getting enough oxygen-rich blood and nutrients, the quality of the nail begins to change. In older adults, one possible reason for that is peripheral artery disease, which means the arteries supplying blood to the limbs are becoming narrowed, often because of plaque buildup. That same plaque can affect the heart and the brain. So when poor circulation begins showing up in the hands, it is not just a hand problem. It can be a whole body warning sign that deserves to be taken seriously. What makes peripheral artery disease so dangerous is how quietly it can build. Many people do not know they have it until the narrowing becomes advanced enough to cause obvious symptoms. But the body often gives smaller clues first. Nails that break more easily, hands and feet that stay cold much longer than they used to, a sense of heaviness, cramping, or tightness in the legs when walking, especially uphill or upstairs. That gets better when you stop and rest. That last part is especially important. If discomfort appears when you walk and eases with rest, that pattern may suggest the muscles are not getting the blood flow they need during activity. I want you to notice how often people ignore this exact pattern for years because they think they are simply out of shape, just getting older, or walking too much. But sometimes the problem is not the muscles themselves. Sometimes the supply line is narrowed. And if plaque is causing trouble in one place, it may be building elsewhere too, which means the risk can extend far beyond your legs or fingertips. I've seen versions of this story many times. Someone says their nails have become thin and weak. They've tried every supplement on the store shelf. They've bought strengthening creams. They've changed their diet, and nothing seems to help. Then, almost casually, they mention that their calves feel tight when they walk to the mailbox, or that they have to stop halfway up a hill because their legs feel heavy. Suddenly, the picture changes. Now, we are not just talking about nails. We are talking about possible reduced circulation. That is why I want you to connect the dots. If your nails have become much more brittle over the past year or two, and at the same time your hands or feet are often cold, or your legs feel tired or cramp when walking, and improve with rest, do not dismiss that combination. Ask your doctor whether circulation testing makes sense. This is not about panic. It is about timing. Peripheral artery disease is one of those conditions where catching it earlier gives you more room to act with lifestyle changes, medication, and better monitoring before a stroke or heart attack ever has a chance to enter the story. Now, let's talk about the third sign, because this is the one you can test in seconds while sitting right where you are. Press down firmly on one fingernail for about 2 seconds until the nail bed turns pale. Then let go and watch how quickly the pink color returns. This is called capillary refill, and it gives you a rough look at how well blood is moving back through those tiny vessels under the nail. In many healthy adults, the color returns quickly, usually within about 2 seconds. If it repeatedly takes longer, especially 3 seconds or more across several fingers in a warm room, that can suggest sluggish circulation in the smallest vessels. Now, I want to be responsible here. Cold hands can slow this down. Certain medications can affect it. One slow refill on a chilly day does not mean you have a serious disease. But if you warm your hands, repeat it carefully, and the refill stays delayed again and again, that is the kind of simple, at-home observation worth writing down and bringing into a medical visit. What makes this test so powerful is not that it gives you a diagnosis. It doesn't. What it gives you is useful information that may reflect how efficiently your cardiovascular system is delivering blood to the outer parts of the body. In older adults, persistently slow capillary refill can sometimes show up alongside reduced cardiac output, rhythm problems like atrial fibrillation, dehydration, poor vascular tone, or circulation issues that may not yet be causing dramatic symptoms. And let me say something important here. When the smallest vessels are struggling, that can matter for the brain too. As a physician, I always think about circulation as a whole body issue. What affects blood flow can affect energy, balance, mental clarity, exercise tolerance, and stroke risk. That is why a tiny nail test should never be mocked as silly or unimportant. Sometimes simple observations are the ones that lead to life-changing discoveries. So, if your refill seems delayed, especially along with fatigue, dizziness, shortness of breath, or a racing or irregular heartbeat, treat that as something meaningful, not something to laugh off. I think about a man who tried this test after hearing about it on a daytime health segment. He pressed on one nail, counted, and the color seemed to take forever to come back. He tried another finger, then another, then the other hand. Same thing. He didn't feel terrible, but something told him it was worth mentioning. That one little observation led to a doctor's visit, and that visit uncovered atrial fibrillation that had never been diagnosed. Atrial fibrillation matters because it can allow blood to pool and clot in the heart, and those clots can travel to the brain and cause a stroke. That is not meant to frighten you. It is meant to show you how small clues can matter. So, I want you to do the refill test the right way. Sit in a warm room, Keep your hand at heart level, press on at least 3 nails one by one, count honestly. If the refill is consistently slow, note it. If your hands also feel unusually cool compared with the rest of your body, note that too. These are exactly the kind of details that help a doctor decide whether an EKG, blood pressure review, or a broader cardiovascular workup may be appropriate. The fourth sign, and the one almost nobody talks about, is a change in the little half-moon shape at the base of the nail. That pale crescent is called the lunula, and once you notice it, you'll start seeing it in a completely different way. On many healthy adults, the lunula is easiest to see on the thumb and index finger. It may be visible on the middle finger too, it may be smaller or absent on the ring finger and pinky, and that can still be normal. What concerns me is not one small variation. What concerns me is change. If the lunula you used to clearly see has faded, become much smaller, disappeared across several fingers, or changed color, that can reflect shifts in the tissue where the nail is actively growing. In some cases, very pale or nearly invisible lunulas can be seen with anemia. A bluish cast may echo circulation or oxygen problems. A reddish change has been discussed in connection with heart strain in some clinical settings. Again, this is not a diagnosis by itself. It is a clue, and clues matter. The reason I put this sign last is because it is one of the most overlooked visible changes in the body. People look at their cuticles, they look for dirt under the nails, they look for chips or cracks, but very few people ever study the base of the nail with any intention. Yet this area can quietly reflect what is happening with blood health, oxygen delivery, and the quality of nail growth over time. I've seen patients feel almost embarrassed bringing it up. They'll say, "This is probably nothing, but I think those white half moons disappeared." Please hear me clearly. It is never foolish to mention a body change you've genuinely noticed. That one detail may be the beginning of a useful conversation. In some cases, blood work reveals anemia that has been draining a person's energy for months. In others, it leads to a wider look at heart strain, circulation issues, or nutritional factors affecting the whole system. So today, I want you to look at your thumbs and index fingers in natural light and ask yourself a very simple question. Has this pattern changed over time? Here's what I want you to do after this video, and I mean today, not someday when you remember. Go to a window with natural light and examine both hands. Look at the color of the nail beds. Look for a persistent bluish or purplish cast. Notice whether the nails are brittle, peeling, splitting, or growing much slower than they used to. Perform the capillary refill test on several fingers and count honestly. Then look at the base of each nail and check whether the lunulas are visible, small, faded, or absent. If you can, take a clear photo of both hands. Photos help more than people realize because gradual changes are easy to forget. What looked normal 6 months ago may not actually match what you see today. If you notice one sign, keep an eye on it. If you notice 2 or more signs together, especially along with fatigue, cold extremities, shortness of breath, swelling, leg pain with walking, dizziness, or paleness, do not wait until next year's routine appointment if something feels off. Call your doctor's office and describe what you've seen. I also want to say this because it matters. Please do not use this information to diagnose yourself or someone you love from across the room. Health is always about the full picture. Medical history matters. Medications matter. Lab work matters. Blood pressure, heart rhythm, oxygen level, symptoms, and physical exam all matter. The goal here is not to turn you into your own doctor. The goal is to help you become a more observant partner in your own care. There is a big difference. Awareness is powerful. Panic is not. You do not need to be afraid of your body. You need to be willing to listen to it. And after 60, that becomes even more important because small changes can be easy to dismiss when life is busy and symptoms feel mild. But often the body whispers before it screams. The people who do best over time are very often the ones who learn to respect the whisper. They don't obsess over every little thing, but they don't ignore clear patterns either. They pay attention, they ask questions, and they act early when something doesn't look right. So let me leave you with this. Your nails may seem ordinary, but they can tell a very important story. They can hint at poor oxygen delivery, circulation problems, peripheral artery disease, anemia, heart strain, and rhythm trouble that may affect stroke risk if it goes unnoticed. None of that means every nail change is dangerous, but it does mean your body may be offering useful information in plain sight. If you found value in this, stay with us here on Health Wisdom, because this channel is built to help you notice the signals that most people miss and understand them in a calm, practical way. And if someone you love is over 60, please share this with them, because one conversation, one glance at the hands, or one question at the right doctor's visit can sometimes make all the difference. Take a look at your nails tonight. Trust what you see. Pay attention to change. And remember, the goal is not fear. The goal is wisdom, timing, and giving your body the attention it has been asking for all along.